As you all know, she's also spearheaded Georgia's response to the COVID-19 pandemic. We are honored to have her join us today and share an update on Georgia's vaccine rollout efforts. And I want to take just a moment to personally thank Dr. Toomey for her dedication not only to everyone in Georgia, but her support of GMA in Georgia cities. We've held weekly calls for over a year now with our members, and Dr. Toomey has participated in 30 to 40 of those calls to share her knowledge and expertise and information with our city leaders so that they can make the best decisions in their communities. And Dr. Toomey, we're very grateful for that, and we really thank you for joining us today, and we look forward to hearing your comments.
Thank you so much. It's wonderful to be here today. GMA has been such an important partner for us in the Department of Public Health in the entire COVID response. And actually the calls we've done with GMA have been among the high points of the work I've done, because I really appreciated the opportunity to talk to so many local leaders and be able to answer their questions and engage their help to get that information out to their constituents in a consistent way. So it's been really a privilege for me to be working with you through this year and a half. This is a timely event today because there's been so much happening on the vaccine front. But there's also some good news in terms of the rates of COVID in Georgia. We right now have plateaued. We are not, or even have a bit of a decline. Our overall percent positivity rate is less than 5%. That's very good. We have not seen the spikes that other states have seen, and I'm going to say that we have not seen them yet. We are hopeful that we can continue to send the message that's incredibly important to socially distance, to wear a mask, to wash hands, and to be mindful of the fact that we are still in a pandemic, despite the fact that our numbers still look quite good at this time, but that could change very, very quickly. Believe it or not, as we monitor the number of variants we have in the state, almost 50% of all of our cases are now the UK variant. That's the most easily spread variant. So we know that we have spreading throughout Georgia, all parts of Georgia, the easy to spread variant of coronavirus. So again, it's very important, whether vaccinated or not, to try to maintain socially distanced meetings and wear a mask when you're out in public. And I'll continue to say that message until we are able to bring those numbers down to a much lower rate. I know everybody has on their mind what's going to happen now with the Johnson & Johnson vaccine. This was I really felt that the Johnson & Johnson was our answer to many of the questions we had. It was very easy to use. It was one shot, one and done. It was very easy to use in a lot of the community meetings that we had, community outreach to various whether facilities or churches or other areas, homebound. But we have joined other states in deciding to put a pause on the use of the J&J vaccine, Johnson & Johnson vaccine, because of the fact that it was identified through the vaccine reporting system, VAERS, that 1 out of 1 million times, and believe it or not, that's how sensitive this vaccine reporting system is. 1 out of 1 million cases, all in women, had an unusual kind of blood clot with low platelet count that needs to be treated in a very special way. And so it needs to be treated differently than other kind of blood clots. Many of you may have friends or relatives who may have had deep vein thrombosis, and that's treated with heparin. This can't be treated with heparin because it will actually worsen the condition. And so CDC felt, and FDA together, felt it was important to get this information out to ensure that providers throughout the country were aware of the potential, the very rare potential of this happening, and to be sure that someone who may have this condition is treated appropriately. Interestingly, all 6 were women. All 6 were relatively young women under the age of 40. So I think we still don't know yet whether it's the vaccine that's caused this or some other situation, and we won't know until CDC and FDA finish their investigation. That's ongoing now. We were told last night on a late night call that they will continue to study the situation and will plan to get back with us in the States in the next 7 to 10 days. So until then, we will suspend the use of the Johnson & Johnson, but I hope that it will be made available again in the future because of its great utility, its great efficacy, and the ease with which it's administered. But I'll keep you informed, and we'll stay on top of this as we move forward. The important thing, though, is that we have plenty of other vaccines. We have plenty of Moderna and Pfizer vaccine available. So all of the clinics that we had set up, the special events we had set up throughout the state, at churches, at the Latin American Association, at other locations, will continue through the weekend, through next week, but using the Pfizer and not the Johnson & Johnson vaccines. So nothing is stopped. We are not going to lose momentum. It's way too important for us to continue. I see the vaccines are the way out of this pandemic for all of us in Georgia. And so we really are trying to continue very rapidly, even though we had a minor setback because of the Johnson & Johnson. I know there's also the other question on your mind is, what are you doing about vaccine hesitancy? We have a unique problem in Georgia compared to some other states. Although our problem is similar to other southern states, I talk frequently to my colleagues in Alabama, Mississippi, Texas. What we're seeing is some hesitancy among communities of color, although we have been very successful in being able to reach those communities, particularly as we move away from some of the big sites and move to special events at churches, within the community themselves, going to senior centers, going to places that are comfortable and familiar. And we've seen that has really helped increase vaccine uptake in many of those communities. We've gone into, for example, the poultry, I worked with the poultry industry to go into those facilities and be able to offer vaccine there rather than having the individuals who work there. Many of them Latino, Latinx individuals. Without them having to go out into the community, they can get their vaccine right there, and it's safe and easy. And so we are really working diligently as well with farmers and the communities down in South Georgia to reach the migrant workers. Our biggest challenge right now is among white community, particularly in rural Georgia, that simply is not interested in the vaccine right now. And I think that this is one of the things that I would really engage you and I engage the mayors. We need your help. I think that there may not be the full appreciation of how important the vaccine is for our state as a whole, for businesses, for us to be able to open up every aspect of Georgia as we want it to be. And there's still a lot of, I think, misinformation and conspiracy theories about where the vaccine came from or what the vaccine will do. And so I think the more we can get that accurate information out, the quicker we'll be able to get back to the Georgia that we all want to have, which doesn't have these restrictions, and we don't have to socially distance and don't have to always be worried that there's the potential for transmission. But it's very, very difficult right now to message this, and I think it's important that the more people we have who can spread that word, the better off we will be in being able to persuade people to be vaccinated. I think the most effective communicators about vaccine are not me or my staff or others even in the local health departments, but you yourselves working with your relatives, talking to your friends, talking to your family members. My own best friend from college wouldn't let her sister come and visit until she was vaccinated because she had some some questions about the vaccine and how it was developed. And I think that gentle persuasion was enough that she was able to get over that hesitation and move on. And I think if we all can do that with our own family members, with our own neighbors, I think that will be very, very important in getting the state where we need to be. The last thing I wanted to say is that I really realize, as I said, that the vaccines aren't going to end the pandemic. It's the vaccinations in people's arms are going to end the pandemic. And so until that happens, until we know that we have adequate people vaccinated, and my goal, and I hope we can reach it together, is 80% of all Georgians vaccinated by the 4th of July, so we can celebrate our independence from the pandemic. That would be a great celebration indeed. But until then, again, you've heard me say so many times, wash your hands, still socially distance, because we know that many people are not vaccinated, and that easily spread variant is out there. Wear a mask when you're out and about in public, and just know that once vaccinated, it is very safe to be with other family members who are also vaccinated or are at low risk. And that to me is the value. It was so exciting to be able to, have dinner with friends who we haven't been able to be with in close proximity for a year. And I think that's the kind of thing that we all are looking forward to, and the vaccination is our key to make that happen. So thanks so much, but most of all, thank you for all your partnership and for working with us throughout this pandemic. Without your help, we would not be where we are today. So many thanks.